My name is John. I'm a physio that works in the learning disability team in Salford, part of the NCA. I'm just going to share my screen with you now. I've done a little presentation to share with you. Let me just make sure that I can get it up. Right, have we got that on now? Right, somebody tell me if you can't see that. Right, so this is me, Adult Learning Disabilities Physiotherapy Team Lead. I've not practiced this, so I'm just going to go through it. Like you just heard, any questions, you can feel free to ask anything at the end. So here we go. So this is me. I'm Jonathan, Physio Team Lead in Adult Learning Disabilities at Salford, so I'll cover all of Salford. We're quite a small team, and we cover the whole of the adult learning disability population. Originally from Newcastle under Lyme in Staffordshire, that's where I was born, that's where I grew up until I was 30. Then I moved to Manchester, over the northwest since then. Originally I worked as a leisure assistant after leaving school. Took me a long time to get into the job that I'm in now. And then I was a fitness instructor for 10 years, and then I just found that really boring. So I had a change of career completely. I went traveling across the USA for a few months, and I came back and decided I was going to study towards something different. A little bit about me. I've always been quite sporty. I play football, I watch football. I'm a Port Vale fan, so that's a bit of a conversation killer up here when you live near Manchester and Liverpool and suddenly you're a League Two football supporter. There's no one to talk to. Rugby league, I support Warrington Wolves. I do lots of running, lots of cycling. Regularly go to gigs and festivals. I've been going to music festivals since I was like 16, so what, 25, 26 years ago. It's quite a different experience now though, because I've got kids to chase after. Very different than when I was in my early 20s. My education, so I struggled when I was at school. I left school without any qualifications. And I know that you're all school and college age. So just a bit of a serious bit to start on. I really didn't have a good time at school. I really struggled. So if any of you are struggling with anything, school's a lot different than when I was there. And I never asked anybody for help. But if you are struggling, there's lots of help out there. So don't just plod along, make sure you can find somebody that can help you out. It took me quite a while to realise what I wanted to do. Like I said, I worked in a gym for a long time. And then I went to do cardiac rehab, which is getting people back on their feet after they've had, for instance, like a heart attack, or they've had, if they've had heart surgery, or if they have something like chronic angina, something like that. So I was in the gym, so I was getting people doing exercise, but as well as the exercise was the education side, so talking about thinking about heart health, as in your diet, as in your food, as in holiday, medication, that sort of thing, to help people to look after themselves in the long run if they've got heart disease. So because I was working full time, I had to fit education around my working pattern, so I went back to school, night school, at the age of 28 to do my GCSEs, because I knew that I couldn't really get much further doing the work that I was interested in without getting qualifications first. So I had to go back to do night school after I've been work all day. I did my GCSEs again, passed them this time, and then I did an access course, which is aimed at older people that wanted to get back into education. So I did a health course, because at that point I wasn't really sure what I wanted to actually do. I'm a physio now, and I've been a physio for quite a few years, but I was really interested in being a paramedic. To be honest, I'm quite glad that I didn't do that after the last couple of years that we've had, but I thought maybe I could be a paramedic, I could be a physio, I could be a nurse, I could be an OT. There's lots of different things, but I knew that I needed to get this health qualification first, so that's how I went about it. So that's when I went to Stoke-on-Trent College. But physio was where I ended up. My background of working in the gym, I did GP referral. I took on GP referrals in the gym that I was working at. I went to cardiac rehab as well. So that was a good background for me, as well as my qualifications to get into Manchester Met to do physio. Because that's one big thing. If you, wherever you want to go and work, get a bit of get a bit of experience in it first directly with that. When I actually had an interview for the paramedic studies course at Worcester University, and everybody there had come from St John Ambulance, so I had absolutely no chance because I'd done nothing like that before. But when I went to the physio interview, I'd got a good background in health and rehab. And when I was studying, my favourite area was always studying neuro. I had a real interest in neurological studies. I always quite liked the autonomy. So you're able to kind of do whatever works for you and for the person. If you work somewhere that's more like, for instance, MSK, like outpatients, there's usually drawers of exercise. So somebody goes in and they've got, I don't know if they've got frozen shoulder or hip bursitis or arthritic knee or something like that. You go to the arthritic knee drawer and you give them some exercises. But if you work in somewhere like neuro, you might be in stroke or something like that, and you might have 10 people that have all had a stroke, and they all get treated completely differently because they've all got very different needs and they've got very different presentations. So I really like the varied nature of that. I had placements. You get, if you're doing physio, you do 5 general placements. So I did neuro, I did community, orthopedics, respiratory, MSK, outpatients. So in there, I've got my core studies of neuro, respiratory, and MSK as like the basics, because you'll always come across them. If you become a physio and you go into the hospitals, for instance, you'll do rotational work, and you'll always come across neuro, MSK, respiratory. There's somebody on every ward with something like that. So you get to do your general placements. And then I did an elective placement at Firefighter Charity Rehab in Penrith. So if anybody wants to become a physio and you've got anybody in your family that's part of the fire service, see if you can go and visit the Firefighter Charity Rehab Centre, because it's amazing. It's fantastic. My wife works for the fire service, and she got me to talk to the manager there, and I went along, and it's an all over body approach. It's like a retreat for a fortnight that people go to who are employed by the fire service, and it's a mixture of mental health and physical health, and it was great. Part of their approach was we go for walks around the castles and eat ice creams walking around the hills, because it's a really calming place for your mental health, and then we go and do exercise after. It was great. So I love that. What's next? Is it working? Yeah, there we go. So my department, so I work in the adult learning disabilities team now, and I have done for 6 years. I'm now the team lead for that. I've never really come across any people with learning disabilities as far as treating them went before. It wasn't until I started working, it was in Bolton, when I met somebody with a learning disability and realised it's quite a different way of working with people, and I really enjoyed it. So a learning disability it's somebody with a significant inability to understand new or complex information and learning new skills. And that's got to be something that happens very early in life, either from birth or you're very young, maybe had a head injury very young. So it's something that happens from birth or from being a very young child, and there's lots of different reasons. So it could be something from birth, so it could be a brain injury when you're young or birth, like I said. It could be chromosomal disorder, it could be severe autism. There's multiple reasons for somebody having a learning disability. Basically in our team, anybody with a learning disability, we can see, no matter what their issue. It could be a neuro issue, it could be an MSK issue, it could be falls, it could be respiratory, but as long as they've got that learning disability, then they can be seen by our team. And we quite often do joint stuff with other teams if it's a particular problem or issue we've not got much experience of, or something that we're not completely 100% confident with, then we'll work with another team that knows that condition better, and then we'd have the learning disability speciality, they'd have the other speciality. And we're quite a small team in a team of health and social care, so we are kind of separate from the hospital a bit. We've got our own budget, and we're our own team. So we've got the social workers team, and then we've got the health team. So there's lots of opportunity for multidisciplinary work, and we work together on lots of cases, because it's pretty rare that somebody just needs one thing. They might need a range of stuff, like there's physio. In the health team, there's physio, OT, psychology, psychiatry, speech and language therapy, art, psychotherapy, and total communication. So that's all of us in the health side. But if, for instance, we went to see somebody who we thought needed occupational therapy as well, and then we thought they needed an increase in a package of care, then we'd have to go and speak with the social team as well. So it's a really big, overall, we're a small team and a very big team, and we all work together very well. Lots of, like I say, interdisciplinary working. So our aim as a team is to help to maximise a person's ability and independence. That's the main thing, to make sure that people can live the best life that they can do, and if we can make that happen, then we do our best. And then physiotherapy looks more at the physical side of things. But my role particularly, like I say, first I worked in Dewsbury, which was like 60 miles away from where I live, so it was a nightmare journey. But once I'd started working, I could put that on my CV, and then I started getting interviews. And then I worked at Bolton, where I first encountered a learning disability role, and I thought to myself, if I see a learning disability job come up, I'm going to go for it. And one came up in Salford, luckily, which was where I was living at the time, and I've been there ever since. And it's such an interesting area to work in. I cover the whole city, wherever we're needed. We do hydrotherapy, we do rebound therapy, we go to people's homes, we go to day centres. During the pandemic, I did assessments in the park, local park, because people didn't want me to go into their homes. I remember one person I turned up and did an assessment through their front window as I stood outside. And so we go wherever we needed and do whatever's needed, whether it's going to the shops for somebody to see how they walk on a different kind of flooring, for instance. We've done that before. Things I enjoy doing are the people that we work with, creating plans with them. So in learning disability, it's got to be very individual. I mean, all plans should be individualised and patient-centred with people, but particularly learning disability, it's got to be very personal to them. And different ways of working, like for instance, if I think somebody's got quite weak lower limbs, quite weak legs, and I want them to strengthen them, I might say, could we do 10 squats? And they might say no, and I'll go, all right, then do you like music? And it's always ABBA, everyone loves ABBA. So I put on Dancing Queen, and if I'll basically dance with that person for 5 minutes, but in the dancing, I'll do a squat and they copy me. I'll do a side step, they copy me. We'll walk forwards, walk backwards, we'll do a lunge. So they've actually done 5 minutes worth of exercise without realizing that they've done any exercise. So it's all about being creative with people. So I love making up plans that are very, very different with each person I work with. Obviously, there's difficult parts of the job. So explain when someone's reached their maximum potential. If you really don't think that somebody could go any further, for instance, if they used to be mobile and then they stopped being mobile and then they needed to be assisted out of a chair, they couldn't walk, they needed a wheelchair, then they needed equipment to get them out of the chair. And then it might come to the point where the home that they're living in just isn't suitable for them anymore. They need more care, and then explaining to that person that, you know, the home that you've lived in for the last 10, 15, 20 years is no longer suitable or safe for you anymore. It's very difficult, some situations, particularly, like I say, with somebody with a learning disability. If their ability to understand and take on the information that you're saying isn't great, it's particularly difficult to get over the reasons why, to justify why you're making that decision. That's when the MDT comes in massively, on the multidisciplinary team, because we'll need speech and language therapy and total communication to help them to get the person to understand. And then there's a whole team decision made. It wouldn't just be me, there'd be lots of people that would all back each other up on the same decision. So lots of interdisciplinary working. Like I said, I've got a very varied role. I'll go wherever needed. I do hydrotherapy and rebound therapy. Rebound is doing therapy on trampolines. I'll show you some pictures in a minute. And we basically go wherever we needed to, whoever needs us. So this is me doing rebound therapy with someone. So there's loads of different things you can do on a trampoline, and it's all fun, but it's therapy. So picture on the left, improving balance. So if somebody's quite unsteady on the feet, they've got a history of falls, obviously that's really dangerous. A fall could cause some serious injuries. If you get them to walk along a trampoline, we put the mat down to make it a bit more sturdy, but it's really unsteady. And the more you challenge that person's balance, the more it's going to improve, because they they will improve their balance, their proprioception, the feedback from the feet to the brain, the balance. That's a good way of improving that. You can improve strength and respiratory function. So bouncing up and down, if any of you have done trampoline, it's hard work. If that person's unsteady, you can see I'm holding their forearm, then not the hands, because they might, if they fell off and grabbed me, then they can take me with them. But their forearms, I'm supporting them so as they don't become unsteady. They're pushing to the legs, lots of strength, respiratory function. Like I say, doing trampolining gets you breathing quite heavily, and if somebody is quite low on exercise tolerance, it's a really good exercise. You might get somebody who needs chest clearance doing. You can lie them down and bounce them up and down the bed. It clears chest secretions. You can get people to clear the chest better. Increase range of movement. You can see where I put the arrow there. The top picture, that person's legs are bent, so we're really struggling to stretch those hamstrings. But if you bounce the bed gently, then you can put a good stretch on the hamstrings without really moving very far. That's just an example of increasing the movement. Hydrotherapy. You can see there's lots of different reasons that you can do hydrotherapy. Relaxation and pain relief. So if you think somebody's been sat in a wheelchair for quite a bit, if you put them in a nice big warm pool, and that's like a hot bath that I'm in there, it's like 35 degrees, I think, 34 to 36 usually. So it's a big warm bath. So we can swoosh people around, we can get them to stretch their legs. So to get out of a sitting position that they might have been sat in for the last 5 hours, put them into a nice warm pool, relaxation, pain relief, great. The top picture in the middle, you can see that's somebody who is a wheelchair user, so they're constantly being flexed over. You can see there we've stretched them right out, so we're having a really good stretch there. The bottom one is getting somebody on the feet again, getting them walking. That person hadn't walked in years, and we got him walking around the pool. It was great. So we were able to take him off using a hoist, and we got him to stand transfer, so he could stand up out of his chair and sit on his bed, or go from chair to chair, whatever. And increasing range of movement. Picture on the right hand side, that person had really stiff upper limbs, so we put her in the pool and basically dragged her around by her arms. There's more to it than that, obviously, but that's what we did, and we really got a lot more movement in the shoulder. And because it's warm water, they will relax a lot more, the people. We do therapy at home. So picture on the left, you can see we work on strength, balance, mobility, movement, activities of daily living, whether that be making sure that somebody can get into the kitchen to get themselves a drink or some food, or making sure they can go to the toilet, or making sure they can get into the bath or the shower. It could be passive exercises. You can see the picture at the top. I'm going through the movement with that person, increasing the movement in the shoulders. The picture underneath is somebody doing some squats. They're doing their own exercise. Manual handling. We can get quite complex manual handling in learning disabilities. Manual handling can be something as simple as helping someone to stand up and walk a couple of steps to a chair or to a bed or whatever. But if that person loses the ability to stand, then you might need a stand aid like the one at the bottom. That's a return. So the person would stand up, that turn is on wheels. You spin the wheels around and the person sits down. The picture at the top is hoisting. So somebody might completely lose the ability to stand altogether, or might never have had the ability to stand, and they need hoisting. So you need to make sure they've got the right kind of sling for them. You hook it onto the lift, and then you lift the person up and wherever they need to go, whether it's into a wheelchair or a bath or whatever. We can do that safely, rather than in the olden days where it was pick them up and carry them, which puts both the person and you at risk as well. Then there's also postural management. So in learning disabilities, quite a lot of people need postural management care. A lot of people have contractures, so they may have spasticity in the limbs, the joints may become deformed, might have really, really stiff, tight muscles and tendons. So you can see the person at the bottom right there, we've got lots of cushions supporting her to keep her quite midline as much as we possibly can. If we took those away, then she'd be pretty much lying on her right side all the time with the legs right over, which just increases the tone on her legs and her hips, increasing pain. So we use lots of cushions and positioning equipment to make sure someone's in a comfortable position. The one at the top there, I'm going through some stretches with them. He's a wheelchair user. Spends a lot of time in his wheelchair, so it's good to give him a good stretch. So we do both upper and lower, and you can see them rolling his legs over, so we're giving his hips a good stretch as well. So postural management is a mixture of making sure somebody stays mobile, moving the joints, as well as making sure that when they're in the chair or in the bed or wheelchair, then they're supported as well as they can be, to make sure that their condition doesn't worsen. So I wrote a quick case study, quite a nice one. There was somebody who was referred to us earlier this year, and he was not mobilising any longer, and nobody knew why. He just suddenly stopped walking. Now he required carer visits to assist him all day with all daily living tasks. He lived on his own with his mum. His mum sadly passed away, so he was left on his own, and he was still able to do basic things for himself, but he needed carer visits every now and then. I think it was just 1 or 2 hours a day, just to help him with shopping and things like that. But all the basic tasks he could do. But then he just stopped walking. Like I said, no reason why. He previously had mainstream physio, but he made no improvements. And he was now scooting himself around the flat on a 4-wheeled walk. I don't know if anybody have seen that. It's a frame on 4 wheels with a seat on it. So if you're walking down the streets, you've got that to support you, but if you feel tired, you can sit down and rest. Well, this gentleman was sat on it and just pushing himself around the flat with his feet, which was really dangerous because it was carpeted, so the wheels didn't move very well. And if he just pushed himself a bit hard, he would have gone over. It could have caused some serious injuries. But he was that's what he was doing, how he was getting around. So I went out to see him. I sensed his strength, which was I was able to do when he was sat down, because he was okay with that. He was really strong. Then I wanted to assess his balance, but I wasn't able to because he would not let go of that frame. And when I helped him to stand up myself, he wouldn't let go of me. And if I managed to free my hand, he grabbed a chair or he grabbed a table or something. He would not stand on his own. And we figured out he was terrified of falling, and we had no idea why. And it turned out that not long before his mum had passed away, she'd had a fall and it had really injured her. And she'd never really recovered before she passed away. It wasn't because of the fall that she died, but he remembers seeing that happening. And he was petrified of it happening to him as well. So his main barrier was psychological, really. And psychological issues can be huge as far as just doing daily activities, particularly walking goes. If you've got it into your head that something bad could happen if I fall, then that can take over, and that can be a real barrier. So we worked with psychology from our team to really get into the crux of why he was scared, what he was scared of, and then make him realise that he hadn't had a fall and he was still quite capable. He still had strong legs and he still had good balance. So we took him into hydrotherapy and we did lots of sessions in the pool, and we got him walking up and down the pool, in the middle of the pool, away from the sides. The first day we got him in, he grabbed hold of the handrails and wouldn't let go. But eventually we got him walking right up and down the middle, because we managed to persuade him that if you fall over in a pool, you're not going to hurt yourself, you'll just float, it's fine. So let's get used to walking in the pool first. And eventually we got him back to walking around the flat on his own. He uses crutches, but at least he's able to walk. So the next step is to get him to walk without the crutch and just walk normally, because he's capable of it. It's this psychological issue that he's got to get past. But now that means that he has less care and is able to access the community as well now, because he can get down to the end of the corridor, he can get into the lift to go down his flat. He's got a scooter so he can get out and he can go to the cafe or wherever it is that he wants to do with the day, which he wasn't able to do before. So that was quite a good one. We managed to get him back to doing the things that he enjoyed, which was going out and meeting people and going to get a coffee with like-minded people. And that's about it, I think. I left this bit in. This was part of the slideshow that was given to me to adapt to me, but I thought to keep it in because it is quite personal, really. So, what career and job would you like to do? Like I say, it took me a long time to figure that out. And even when I decided that I wanted something in healthcare, I didn't know what exactly, but I knew what qualification I needed to do. I needed to go back and do my GCSEs, and I needed to get the the access course to get to university, then do university, get the degree, and then go and do what I wanted to do. What do you need to do? What do you need to do at college for that degree? Well, again, like I say, I had to go personally, go back to night school to do the right GCSEs, which is at the bottom there. So that's me then. And has anybody got any questions? I'll stop presenting now. There you go. Is that okay?
So we've only got one question so far.
Mm-hmm.
When you do placements, is it chosen by your university, or is it what you choose?
It's usually chosen by the university. To be honest, a lot of times we get kind of sort of last minute requests, can somebody come and do a placement with you, because placements, I think there's not that many, so the university sorts them all out for you, unless you've got a particular area that you want to specialize in. Like for instance, in pediatrics, there's not many placements for that, because it's quite a rare, it's quite a smaller area to work in. So you could request that specifically. The elective placement is all you. You decide whatever you want to do there. When I was at uni, some people went and did theirs in Nigeria. Others went and did it at the local private practice. People went all over the place to do it. So the elective placement is all down to you. But the other placements are usually chosen by the university, unless you've got a real specific interest in one area, then you could request it, but it's usually the universities.
Thank you. So another question. I haven't had the opportunity to do physical work experience. Is virtual work experience okay though?
Yeah, I don't think it's a minute, because lots of hospitals are still not allowing people to come into hospital unless you're absolutely needed. So unfortunately, students, well, yourselves, work experience isn't. So yeah, even if you just show willing that you've done something like this, if you can put this on your CV and say that you've been to a careers talk with a physio, and you specifically heard about or asked questions about physio, then yeah, definitely put that on your CV, because when you're applying, there won't be too many people that will have been able to do much work experience, to be honest. There might be a few that were like therapy assistants, for instance, but if you're coming from college, there's not really much more that you can do other than ask people to do virtual talks with you. I actually did one of our speech and language therapists' nieces wants to be a physio, so we did a presentation, a talk with her, so she's putting that down on her CV as I've shown willing by doing as much as I possibly can. Because like I say, actually being physically on a ward and in a hospital or in a practice right now, you'd be very lucky to get somewhere, I think. So if you're doing things like these, then yeah, virtual ones are about the best you can do at the minute, I think.
So we've not had any more questions at the moment. If there are any more, just put them in chat, or you can use the raise your hand function in Teams. Okay.
Right, is that it then?
Yeah, we'll just give it another minute to see if any come through.
Hi, I'll ask a quick question, Jonathan. What advice would you give to your younger self?
Oh God, this is probably too long to talk about. I wish that I had. I wish I'd started my journey younger. Yeah, like I said earlier, I left school without any qualifications, so I left. I wasn't very good at school. I wasn't a bad lad, but it wasn't for me at the time. And I don't know whether it was me or whether it was the teachers or what. But when I left school, I wish I'd stayed in education for longer. I mean, I had a great time leaving early, and I got a job, and I went and did traveling and things like that. I experienced things, but I wish I'd stayed in education for longer and looked down a professional avenue quicker than I did. I mean, I've got here in the end, but yeah, I didn't make the most of education when I was younger. It took me a long time to get into it later. Like I said, I don't know why that was particularly. It just wasn't for me at the time, but sure, school's very different now than it was when I was there. Yeah, I wish I'd taken more opportunities that were there at the time.
Thank you.
So we've just had one more question. Are there any good resources to research to find out more about this as a career?
Specifically LD physio or just physio in general? Well, physio in general, you could try the CSP website. The CSP is the Chartered Society of Physiotherapy, so that's the body that I'm a member of, basically. If you wanted to look into LD, then that is ACPPLD. I think CSP is a great place to start. Just type in csp.com and it'll take you straight to Chartered Society of Physiotherapists, and on there is loads of information, whether it's about up-to-date guidance on approaches to physio, or whether it's about information for students, or whether it's for professionals. You can join as a CSP member just as a student as well, and it's really cheap when you start very young. Then when you actually start working, it's more expensive, but the CSP is the best place to start, and the ACPPLD is the learning disability branch of the CSP, if you get what I mean. But start with CSP, there's loads of information on that. At least you just put on what is LD. Learning disabilities. That's the area that I specialise in. Is that separate branch? It's of physio. It's when you become a physio, you tend to do the rotations first. So you'd be in various different settings. So you might go and work in outpatients, then you work in neuro, then you work in respiratory. So as a band 5 and some band 6 as well, you do rotations, and then you start to think about where you'd like to specialise and where you'd like to work. So it's just another area of physiotherapy. Learning disabilities. If you worked in a particular area, then you'd get referrals for that area. So you get referrals for respiratory, MSK, orthopedics, wherever it might be. But if you work in learning disabilities, then It could be any of those things, but the person would have to have a learning disability. So it's just another area of physio.
Is there any more questions, Matthew?
No, it doesn't look like currently. That's the. If there are no more questions, I suppose we can wrap up now. Thank you for that, Jonathan.
Okay.
Thank you, Jonathan.
That's all right. Hope it was useful for someone.
Yeah, no, it was very useful. Thank you.
Right, great. All right.
Bye. Bye. Thank you.
Bye-bye.